Solutions webinar, Making NextGen More Efficient, Tools Created by the NexPerts. And at Itentive, of course, we are the NexPerts. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention this webinar will be recorded. We'll send out recording of these slides and the recording within the next week. Next, for those of you who aren't familiar with Itentive, I want to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we also have two add-on productivity solutions for next-gen, ChartGuard and RefundManager. Next, I wanted to mention some upcoming webinars we have planned. The real-world impact of 5.9.1 and 8.4.1 from a next-gen beta perspective, transforming patient access to healthcare using telemedicine, and PCMH, all the questions you've asked, answered. We're still finalizing the dates for those, so keep an eye out for an email invitation from us for them. We'll also announce them on Facebook, Twitter, and LinkedIn. Okay, so back to today's webinar on making NextGen more efficient. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Cindy Kincaid is Vice President of Client Solutions, and Lindsay Lanning is our Healthcare Compliance Consultant at Itentive. So Cindy, the webinar is all yours. Feel free to get started when you're ready.
All right, well, thank you. First of all, we're going to be talking about making NextGen more efficient, tools created by the NexPerts. Some of these tools that we're going to be offering are complementary. Others, they are available as products, offerings, and other solutions that we provide. We wanted to share information about all of these by giving you the perspective of a client, not necessarily from a sales perspective, but why these are important and how they help, because sometimes that comes through a little bit clearer when you look at it from the next-gen perspective. So today, we're going to be talking about efficiency scripts, the patient portal auto-enrollment functionality, quality templates, and then some Itentive productivity tools, the Unapplied utility, iCare ServerHealth, ChartGuard, and RefundManager. So first of all, the custom scripts that we'll be talking about, why we did this. We do custom scripts all the time, and we're going to be presenting a few of these because we listen to our client needs. Sometimes we observed them when we were on consulting engagements, and through custom scripts and templates we created to allow NextGen to better meet their specific practice requirements, perhaps save some time, keystrokes. Each solution presented today is in production at one or more client sites. So everything we have and we're showing you is actually being used somewhere to help a client get through different areas. So the first thing we're going to talk about is the RVU SSRS Report. This is a report that we created to help with Medicare reimbursement strategy that uses relative value units. The Provider Productivity by RVU Report allows for charges to report under the primary financial class on the encounter. The report collects and displays data based on columns and sorting types selected, and it's the only summary report that allows showing charge info with RVU data. Most practices that are using this to track provider RVUs for a specific time frame. So if we look at the sample of this, rather than the dates going up and down on the page under each provider, they go across the page for better trending. So that's the first change we made. This is based on a process date. It defaults to all providers. So in the example we've presented here, we have the default date range set to the current calendar year for the month preceding the date it's run. So for example, if we run in January, it will run for the last full year, it will run February, it will show January of the current year. If we run June, the same thing for January to May of the current calendar year. Customizations could be based on how it's worked is the date by which it's pulled. You can change to charge create date or service date. You can set up a default date range, change to FYI calendar or 6-month range, and default to all or none so that the user must select. So these are some options you can do as it relates to this particular report. So before we move on, I am going to be telling you as we go through these, the RVU report we will be offering to anyone on the webinar. If you would like to have it and you have the expertise to put it in, we'll be making that report available to you. It is an SSRS report. And we'll also be happy to package it, send it over to you, and let anyone that's attending the webinar today have that if you feel it would be something that would help you. It's a much better view than the standard reports coming out of the package. The next report we're going to be talking about, or actually script we're going to be talking about, is also something we're going to be providing to everyone complimentary. It's the payer cleanup script. So this script searches the database and payer table and removes any payer that is not currently associated to a patient chart. If a payer is active or inactive in a chart, that will not be removed. This only includes payers that do not have an association to any chart, and it's suggested obviously that we always run this first in test prior to running in prod. The benefit to this is have the payer list cleaned up, and it's also improved search time for payers as the list is drilled down. We all know that if you've been in NextGen for year after year after year, your payers have changed, they've morphed, and you can sometimes have all of these payers in the system that were created for some reason, but no one really understands why. And this is an easy way to clean this up. And as I said, this is also one we'll be providing to everyone if you would like to import this into your system, or if you have the technical expertise to run these scripts, run scripts all the time, we'll certainly make it available. Specialty specific script. This is a script we generated specifically for our gynecology group we work with. And what this does is it's a stored procedure that automatically puts the next annual visit date in a user-defined field. The date is viewed from within the appointment window. Now what it does is eliminates the need to look back to find the last annual visit. For those of you who have worked with gynecology patients who are coming in for their annual exams, what basically this does is you had to make sure that from the last time you billed this from an insurance perspective, you had to have at least 1 year and 1 day. So what we found is we were observing clients that were doing this, they had to hop out, go in, check, because you could rely on the last appointment, but the challenge with that is what if they didn't show up? What if they canceled? What if they came in and had a problem visit instead of the annual, and maybe the annual actually occurred 2 or 3 days before or 2 or 3 days after? So we based this on CPT code. So it actually looks back at previous charge codes and calculates the next visit date by the required time frame. So how this shows up is the stored procedure runs 1 or more times throughout the day. The client provides a UDF that is visible on the appointment for this functionality. So we pick the user-defined field, and you can see in this example it's annual next eligible. The field is populated with the next date the patient is eligible for an annual exam. It also adds an alert that will display when the patient is accessed. So it basically, when you first bring the patient up, it tells you the patient is not eligible for an annual exam until such and such date. Once the patient has the new annual exam CPT added to their charge records, the date will be updated to the next available date. So there's really no more digging around the patient chart to see when they had their last annual exam. We will also be making this one available this stored procedure available to anyone who can use it. And with expertise, there are other procedures. This is specifically used for gynecology, but there are other examples where you may have a time limit or a time constraint between the visits, and to make sure that this happens and be able to go out without actually having to go out and check for it. So it's based on CPT code, and it's based on the code at the time the patient was in the patient's record. Now we'll move into the uncollectible write-off script. This one's a little bit more complex, but we've done this for several of our clients, and we'll kind of take you through how this one works. So first of all, the uncollectible write-off by financial class script can help automate the writing off of old balances. You can do it one time as a cleanup, or you can make it ongoing. If you make it ongoing, we suggest it be run monthly. It can work with multiple batches, Medicaid batch, Medicare batch, etc. It only impacts primary payers. And then once it's created, the batch is then delivered to the end user for review to then post or send to BBP for posting. So it basically goes out, adjusts these off, creates the batches, and then prior to actually writing it off, you would review it as a batch in your batch as you would normally review any batch. The script creates a batch that the practice can review, edit, and post or mark for BBP posting if you have a BBP posting package. The script ignores items that need a manual review. So in terms of, to kind of keep in mind of what it's going to be picking, like items with a credit in Insurance 1 and a debit in Insurance 2, or an encounter credit. If you have 2 financial classes you need write-offs for, there would be 2 separate scripts that would need to be delivered, and they would run in succession, creating a batch for each financial class. This saves a ton of user time if you have old AR that needs writing off. The next productivity tool we'll be talking about is the Encounter Credit Report. This report provides a list of all encounters with a credit balance. In addition, it provides the details behind the credit so that you can see how and when it occurred. You might use this for trending or identifying training opportunities. You'll see the encounter balance line as well as the charges, payments, and adjustments that occurred on this encounter. There is an option then to generate the report results based on when the credit occurred, create date or posted date. So this may be helpful in isolating a recurring issue. You can take delivery as a stored procedure and write the report yourself, or we can write the report for you in SSRS or Crystal Reports. SSRS offers a subscription option for auto delivery to the folder in an email, so that's one of the reasons that we like this. One of the things I wanted to add is all of you can request the scripts by replying to the follow-up email that we're going to be sending with a link recording in a few days after the webinar. So we will actually be putting that out there for you. So I know we've had some questions on that. So just send it to reply to the email, and then we'll be able to get that on going forward. All right, moving on. And we are going to be moving through a lot of these because we have a lot of things we want to show you today. So if I'm going too fast or you want to have anything, please put in a question in and we'll answer them at the end because we want to get through all of the offerings that we have to present. The next thing we're going to be talking about is the patient portal auto-enrollment scripting. Now what this does is the auto-enrolls eligible patients in the patient portal without the need to provide a token. Patients must be over 18 years, this is out of the box, never been enrolled, or those who do not have a pending enrollment, have been seen within the last number of days. It's variable. The default is 4 days. Longer ranges can pick up patients who did not previously enroll due to missing emails, but now have one, which aids in patient outreach. So what we mean by this is that you can actually, 4 days is to help you with the requirements for MACROP. However, longer ranges can initially be done to pick up patients who have not had one. It provides temporary credentials that the user is required to change on first login. So we can give you some configuration and help you set that up and give you ideas on how to do that to ensure the patient's privacy, because there are some criteria you can put in to do this. Once everything has been configured, it runs on a schedule periodically throughout the day. It can handle up to 100 enrollments per hour. Most frequent would be every 30 minutes if you have a large new patient population. And more frequent schedules mean patients get their enrollment email closer to their appointment time and could be logged in before they ever even get seen. So in the configuration options that you can take and put this on a schedule, we can actually do this in advance. Full disclosure on this, I do want to say NextGen is making improvements in their portal, and they're going to be seeing some updates to this, but for now, this is the fastest and quickest way to do this by using the NextGen bulk enrollment tool. They will give you the tool, but they don't actually create the scripts or help you pull all this together. So this is a program we have developed, and we've had numerous customers take advantage of this. Few more criteria. It says must have patients' email in the chart, so the email must be there. It will identify patients when checked in and send auto-enrollments out in batch intervals, once or twice a day, etc. The patient, as I said, receives a temporary username and password to log in. How it helps you is it eliminates front office workflow of having to go through the enrollment process, tokens, etc. And we've all had to enroll those patients with tokens, and we know how often they lose them, how often it becomes a problem, and it saves steps in the new patient workflow. Initially, it can be set to go back for a predetermined amount of time, 30 days, for example, or you can go back further to capture any patients that were seen or may have been missed. So why? They're automatically considered enrolled by bypassing the pending stage, so information can be sent right away instead of waiting for the patient to log on for the first time. So that's really important note with the tokens. They have to come in and get it, whereas in this case, because they're enrolled and they've got their temporary username and password, which will be forced to be changed, they will actually be able to go ahead and we can send information to them. This greatly reduces the need for tokens. It improves patient participation in care, and auto-enrollment can be used to transfer all of the non-NextGen patients that currently use another patient portal into the NextGen patient portal. So this is another feature that can be added to it, that if you have transitioned from one package to another, you're using a third-party portal and you've decided to change. We've had a couple of users who've done that. Then we can use this. We can do a batch enrollment over a period of a few days and get all those patients set up with their new temporary logins and passwords. So I'm not going to go through all of the sample services as to how this actually works, but I'll just highlight it. It uses a SQL job to calculate the patient's age. The criteria in SQL script select the patients that have a valid patient name, are less than 12 or 18 plus. You can make this over just 18. A lot of users do that because of the minor confidentiality records. The SQL script is used to generate the username, password, and security answer. The SQL script populate the auto-enrollment tables and develop an auto-enrollment and unenrollment SQL logging process. As I said, this is a program and product that we're offering. It's not one of the complimentary ones, but it is something that we really want to make available to everyone and have quite a number of clients who have picked this product up. If you decide to move forward or you're interested in it, you can also add request additional logic for separate person groups, enrollment reports, specific username, passwords, or other security information, or you can customize an introduction to the patient portal email that's sent out to the patient. The requirements and decisions, we're not going to really get into at this point. If you were like to move forward, you would have some decisions to make. We would certainly take you through all of that, but we wanted to put the slide in so that when you get the copies of this, you'll be able to take a look at what would be involved and give you details of how this actually works. Now we're going to move on to the quality template. This is also an optional product that we are presenting to our clients, and this came out of a result of working with one of our larger clients on a way to help improve things with their providers. So what this template does is it's a one-stop shop for all quality programs. Meaningful use, MIPS, PCMH, quality measures. As you know, in NextGen, you have to today jump all over the place. What it does, it combines the fields providers in one place. It's actually pulling in shared NextGen fields on other templates and sharing back to the NextGen template. So we're using all of the NextGen fields for this, but it's really a way to bring this in and let your providers go through and look at this. It can be customized based on your quality programs and goals, and we have orderable items from the template. Here's just a couple of screenshots of how it might look, and this is two different versions to give you an example of how it can be tailored to what the client wants. And this just literally lets you look at seeing how that you've got your templates, you can go through your huddle, your discussion, your decisions, and then you just basically, in this particular case, your health questionnaires, and then when you click on the links and the active links, you'll be able to move and pop up the other templates that you're needed, and then they come back in and you just go back and forth, and the provider gets to stay in one location, whether it be the EMA for the intake or the physician once that they're treating the patient. Just a few more screenshots that you can see as to how this works. This is just a few examples of templates that you can link on for the quality template. So what happens is these links are all on the main template, and they just pop up or pull them in, and then you go back to where you were. So again, the provider who is never having to move from the main template, and it's also sharing the data back to all of the templates that where these originated from. Now, before we move into the productivity tools, I just want to clarify a few things that we presented in the past. These are all very items that we have in use in many of our clients, and we'll be happy to talk and share with them to you. To move on to the productivity tools, Lindsay's going to take over this section, and we'll talk about the different tools that we have available in this suite.
Great, thank you, Cindy. Well, as Cindy mentioned, I'm going to introduce you to one of Itentive's productivity tools. The first being the Unapplied utility, which is a solution that will allow your practice increased automation for practice management functions. So this Unapplied utility automatically moves patient payments collected and posted to the Unapplied bucket quickly and successfully to a patient encounter once charges are posted. This feature can be set up to routinely run and keep your Unapplied payments clean and up to date. So I'm going to ask each of you on this call to ask yourself, do you know how much is in your Unapplied? And does your staff spend numerous hours applying Unapplied funds? Now, these might be tough questions to ask, especially if you really aren't sure of the answers. Most practices have different reasons why they end up with Unapplieds, and a lot of times don't have the time or resources to apply them, which leads to extremely high balances. First off, I want to point out, if you don't know how much is in your unapplied, where you can find that information. In PM by running the Unapplied Accounts Receivable Report. This report lists all the current unapplied credits and is designed to group all the records that were part of the unapplied transaction. If the records net to zero, then the unapplied has been totally utilized. If there's still an amount left, that is the amount remaining that has to be applied to charges. So how do unapplieds add up over time, and where do they even come from? Well, there are three main reasons unapplied payments don't automatically apply during charge entry. The first, charge entry staff didn't open a batch or set of batches active. The second, the encounter co-payment was not entered on the insurance maintenance screen during the check-in process. And then finally, the first charge line item total is actually less than the amount of the unapplied. So, for example, if you collect $20, but the patient has a post-op charge of $0, but there's a second procedure that has a charge amount, unapplied payments during charge entry only apply to the first line item. So how does this utility remedy these unapplieds? Well, for the encounter unapplied amounts, you can choose if the unapplied amount is equal to the patient amount, apply it. If the unapplied amount is greater than the patient amount, either apply all of it to put a credit on the encounter, or apply up to the patient amount, leaving the remaining in the encounter unapplied. If the unapplied amount is less than the patient amount, apply the entire unapplied amount. If the unapplied amount is one of several specified amounts, so useful for copays, apply up to the patient amount or apply with credit, and then move any remaining encounter unapplied amounts to the account. Now, for the account unapplied amounts, you can choose either to apply it to patient amounts, so first matching amount or the oldest amount, then forward. Or for remaining account unapplied amounts, put on the newest encounter or put on the oldest encounter. The scope of the encounter work can be limited to locations, providers, or SIM codes. Now, taking a look at how this utility actually thinks and prioritizes charge balance selection, encounter unapplieds will only be used for charges on that encounter. Patient balances always have priority over third-party insurance balances. Then balances are selected on a COB order, so primary, then secondary, then tertiary. For account unapplied balances, the process selects the oldest encounter first. Now, you still might be wondering how this works. Well, what we've been doing until recently is to use a set of building blocks or SQL stored procedures which do basic functions like move encounter unapplied to charge, or move encounter unapplied to account unapplied, etc. Then we would string those together to meet the client needs. Well, recently we put a user interface on top of it to let the client pick the rules they'd like to use. When the script runs, it'll look up the selected rules and perform those actions. So on your screen, you are actually looking at a screenshot from the user interface for Itentive's Unapplied tool. The user interface is where the rules are selected for handling unapplied balances on the encounter and account level. So since this is our tool, if there's something you need it to do that it does not do today, we can visit adding those features. The Unapplied tool can run interactively to generate NextGen batches with the transactions to move around unapplied balances. The resulting batch is not posted. This is so it can be reviewed by the staff before posting. One of the best features about this tool, I think, is that it'll handle specific amounts, think common copay amounts, and specific SIM codes. Additionally, it'll push credit balances down to the charges so they can be refunded. It will also check for balance mismatch issues between transactions and bucket balances. If there is a discrepancy, no changes will be made to that encounter until the data integrity issues are resolved. And finally, it avoids encounters with countering balance amounts. So some balances are positive and some are negative, even if those countering balance amounts are on different charge lines. It also avoids encounters with unposted transactions. Continuing on with key features, it can be run in select query only mode so that a preview of the record can be reviewed prior to any batch creation. It creates an unposted batch per practice so that the changes can be reviewed in practice management before posting. This utility can move balances from third-party buckets to patient balances in the amount that will be adjusted by the unapplied amount. When this occurs, an encounter note will actually be created for documentation purposes, and it can be ran for a single practice or a group of practices in one pass. Unapplied transaction codes are read from each practice's setting so that different practices can use different transaction codes. And then lastly, while I don't have this on the slide, I consider it a key feature that we're willing to customize this utility to meet client needs that we may not have run into yet. So if we found a really high balance of unapplieds, what does that mean to your practice, especially if you don't clean them up? Why is this important? Overall, what's the value add here? Well, for starters, your financial reports would not be accurate. This means information regarding aging categories, physicians, and financial classes would not be correct. Basically, your practice has money that's not being accounted for, and therefore it looks like things are unpaid, which means you're missing out on revenue that has not been, or that has been paid by the patient. All right, so moving on to iCare ServerHealth, I'm actually going to pass it back to Cindy to continue on with our productivity tools. We really just wanted to give her a quick break from speaking, maybe get some water, but it is back to you, Cindy. It's all yours.
All right, thank you, Lindsay. All right, one of the productivity tools in our suite is the iCare ServerHealth. This is one that we are most excited about because over the years, we have observed a lot of challenges that you have with NextGen and your servers. So we want to kind of talk about what this offering is. What is iCare ServerHealth? Well, first of all, it's a unique monitoring, alerting, and remediation service crafted specifically to ensure the availability and performance of your NextGen healthcare environment. It offers proactive monitoring and prevention services. It's self-healing and automated remediation. It can actually fix some things. Alerting when there are problems, and then there are some very specific NextGen customizations. The bottom line is it's designed to keep your NextGen environment available for the best patient experience possible. Why do we build it? Well, we at Itentive are also a hosting organization. We host NextGen. So we needed a solution for our hosted clients and understood more than basic Windows and hardware monitoring. It needed to understand NextGen. We wanted it to be actionable. We wanted it to send us alerts that mirrored performance or availability issues that impact end users of PM and EHR. We wanted to economize labor because there's a lot of labor that we were taking to be able to keep these services running, and we'll talk a lot about some of those specific services when we get into the details. But we all wanted to automate the remediation where possible, so we didn't have to actually go in and fix things. We wanted it to find it and fix it. And then we wanted to resolve the issues before they impacted the users. Many times there are things that happen and it's not available and it affects your patient care. We wanted to know that before it happened, particularly those things that could be remediated without your having to pick up a phone and call someone. So I'm just going to go through a few of the bubbles that we have about, does this sound familiar? My NextGen is so slow. Why was that EPHI saved there? Where's that? Sally had permission to do what? Why do I have to call the help desk to tell them there's a problem? Why don't they know it? My BBP has stopped processing. My report server is not current. And my communication server stopped talking to whomever. And one of my favorites, the offline document processor is not working. Why did my health quality measures not update? So how can we help with that? Well, first of all, let's talk about the self-healing auto remediation rule library. It attempts corrective action before escalating to an alert. We have some custom extensions specifically for NextGen. And then there are remediation support services that we offer on top of just the monitoring. So there's a couple of levels of this that we offer to our clients. Obviously, the Windows automated patch management, missed patches, compliance reporting, apply approved patches if that's the case, apply any updates. Then available compliance reporting, quarterly server statistics, and quarterly server health reports. Now let's talk specifically about the NextGen Extensions. Let's talk about Audit Health. We monitor your NextGen environment to ensure that the connectivity to the audit database is maintained and alerts during error conditions. This is important for HIPAA compliance. We had an example after an update. Some of you may have experienced this, so I don't want to get into the version, but it was a couple versions back, where they actually put the Audit Health or the audit database offline, and you weren't notified about it. The actual monitoring helped us find that and remedy it very, very quickly. Communication services for ERX. We monitor your NextGen communication services, including the portal and prescriptions. And if issues are found, we'll try to self-heal it or an alert if unsuccessful. Many times we get alerts on the ERXs as well as the portal. The portal communications are not working, and I know we get those from NextGen as well. This can actually track some things down. We also had one circumstance where we were getting so many alerts from so many different clients who had this program that when we reported it to NextGen, it was a NextGen problem. They actually had not discovered it yet. We were really pretty proud of that. Your fax health. We monitor the fax queues to ensure your prescription labs and other important documents are getting out to ensure timely patient care. And then HQM health. We monitor your HQM environment to ensure that your quality reporting is timely and up to date. ICS remote scan, again, another area. All of the communication services we are actually monitoring. So alert the images have made it to the server repository, and alert if any have been found missing, and more importantly, alert if the images are not removed from the local workstations. HL7 interface help. We monitor all of your important interfaces to ensure that they're up and operational, and if issues are found, we'll try to self-heal or alert if unsuccessful. The online document processor, while this has improved, when I say improved, it's for those of you who've been around NextGen as long as I have, that you know that there was a time that we just actually had a person who was checking the online document processor. We monitor this now via the tool, and if issues are found, we'll self-heal or alert if unsuccessful. Report ServerHealth, same premise. We validate that the current report server backup jobs are running and the database is up to date. Background business processor, template cache. Nightly, weekly SQL jobs. Custom interfaces, maybe your non-HL7. Examples could include SFTP, WINSCP, custom scripting development, MRF, custom applications that go beyond the NextGen application, audit compliance, monitor access to the NextGen databases from outside the NextGen application, which has bypassed the audit database. All of these are continued capabilities within the NextGen world. So it goes without saying that your server and network infrastructure is the backbone of your business. Interruptions are costly to productivity and dissatisfaction, and your IT departments are responsible for ensuring uptime and performance. It all starts at this layer. And with all of the monitoring and everything that's going on out there, while we haven't talked a lot about it in this particular session, think about how important all of this is, particularly when it comes to audit and your EPHI and all of the news and everything you're hearing. This is one of the things that drove us to create this to help our own environment, and we've decided to offer it to others, and we've had great success with that. Some other monitoring examples are failed logins, active patch and AV management, services, processes, performance counters, memory paging, process overutilization, user counts, storage thresholds, SQL Server services, files and directories, print queues, etc. I don't want to, again, get into details on each of these because our main focus today is NextGen and how it can help in that environment, but all of this is inclusive in our program that we're offering. This is just an example of the dashboard that actually shows this. I won't spend a lot of time on this, but again, just type of the reporting services and tools that you'll see. And then alerting. Alerting is notification via email, escalation via email, integration with our support ticketing system from Remediation or yours, extension of our ticketing system to your practice. That's an optional license. Alerts generates tickets for you with easy escalation to Itentive ticketing system for higher tiered support. So custom scripts. At Itentive, we understand some solutions can't be one size fits all, and that's why iCare ServerHealth is also customizable. Just as we've shown with some of the other programs, we try to be flexible with these offerings and make sure that we appreciate that every NextGen practice is different. You've seen one, you've seen one. So while we want to make many things available and as consistent as we can, we do understand the need that sometimes that can change. So in this program, we offer custom monitors, alerts and escalations, and remediation. So I think we've already kind of talked about the value, but the value really is prevention. It works all the time, an extra player on the field 24/7. While you're hiring individuals to do this, this is also monitoring and taking care of things while you're asleep. It's a supported product. The subscription includes upgrades, and it does more than just NextGen. While NextGen is our focus, it really includes critical system resources that go beyond NextGen. I know that when you're using your product day to day, that may be what you always see, but the problem isn't always NextGen. It could be something else, and that's just impacting the way you see NextGen. So it looks at the holistic overall health of your system. Now we're moving on to ChartGuard. This is another product that many of you may have seen at some time or another, but we wanted to talk about it a little bit from a different perspective. So what ChartGuard is that we all have come to rely very heavily on this EHR system, and that's what we need to see our patients. And you want to have everything up and you can take all of your records, but bottom line is sometimes your systems go down and you still need to see your patients. So ChartGuard captures patient clinical data into PDF documents, which are stored then at each location. This is really for when your network is down. It provides module data, your EHR documents, and ICS images in a PDF document per patient. Provides an appointment listing for each site, and it's unique in that it provides access to clinical data even during a total network outage. And it's used by practices with hundreds of locations and those with only a few locations. So it's a business continuity solution that ensures the availability of your patient charts during EHR downtime. That's really the simple description of what it is. So what are your options? It temporarily closes when you are down. I mean, what are your options? You temporarily close the practice location. You go to paper charts, manually maintained, labor intensive, which no one really has anymore. It's a fully redundant technology. I mean, most people can't afford that, where you have servers, networks, and stands in a different data center, power cooling, etc. And even going hosting has its risk for access, because if your network can't reach the hosting center, you're down anyway. So some of the nightly deliverables associated with this is a daily appointment listing, each location, patient data sheet, module data, allergies, immunization, labs, medication, and problems, your vitals, the KBM template, documents, set and forget, but tested occasionally, and a 3-day moving window, and that's customizable. So normally it keeps it the last 3 days, because if you had a power outage, you know, we in Columbus had some areas where some of the offices were out for a week a few years back when we had a kind of a bad storm. I know you've heard about it on the news with other areas. Now, if the power's out in your office, this isn't going to work either. So I want to be very, very clear. But it could be that the data center is down and you just can't get access, or some of your offices are down and others are not. So it's still a continuity solution for those scenarios. Configuration is a practice-defined safety net. You pick how many days or charts you want to generate. So we said 3, but it could go back further or even less. ChartGuard can be customized to match your specialty, KBM level, and number of locations, so it's not KBM specific. The appointment listing can be customized to meet the front office needs. So there can be some variations there when you first configure and set this up. Here's just a sample. So it's a simple PDF document or EHR content. It's bookmarked for easy navigation. So this is how it's going to look in a bookmark. So it's a PDF. The file is labeled by patient name, date of birth, and then medical record number. The patient data sheet, module data, allergies, immunizations, labs, medications, and problems, the vitals and your KBM templates, documents, and then it includes all associated ICS images. So here's just an example of the information and how it's presented. So you can see the demographics for John Doe, the allergies, the medications, and then the labs for John Doe. And this is how it would be presented, and you would be looking this up into making your documentation. Here's just, again, some samples, your document master IM on 920, so this is there, and then your ICS image. Before we move on to Refund Manager, I want to talk a little bit more about ChartGuard if there's an interest. There are numbers of other areas that you can use ChartGuard for if you're looking for any type of mass transit of data, for any type of archive utility, because we've had some groups that have put this out into an archive environment. So kind of think out of the box with it, because we have groups who have used it as their downtime solution, but also come up with some new and inventive ways that they can utilize that as well. Now, as we move on to Refund Manager, this is another Itentive product, and the purpose for this is making your refunds easy. For those of us who have worked in practices or worked in this industry for a long time, refunds are probably a really big challenge, and they're becoming a little bit kind of toned down for a while. And now with some of the different insurance carriers and some of the different plans that are out there, they're actually becoming, let's just say refunds are making a comeback. So this streamlines and automates your refund process. It quickly handles credits in NextGen. It integrates your financial system to NextGen, eliminating data entry. So when you have Refund Manager, you can actually, update your general ledger system. So it supports a variety of financial systems, including QuickBooks Pro, QuickBooks Enterprise, Dynamics GP, Peachtree, Sage 50, ACCPX, Sage 300, and more. It's extendable to integrate with your own financial system via XML and CSV files. So even if we don't integrate with it automatically, you can output the data in a format that can be read in a large number of systems. The overall goal is to reallocate the resources in your practice to other areas of billing and accounts receivable, and spend less time sending money out and more time bringing money in, using scrubbing claims or insurance refiles. Some of our clients, we got a few quotes, said that they've reduced from days to hours now. Accounting system integration is awesome. Refund Manager even updates patients' accounts back in NextGen, which it does. It's kind of a utility that goes outside of NextGen, but it functions as though it's in NextGen. It pays for itself in time saving alone. The identification of credit balances is great, what we call the Credit Scout, and that's part of the Refund Manager product, and invaluable for reallocation of credit balances. It consolidates checks into a single check. So if you have multiple refunds on that patient, it'll send it out in one check. And this is kind of how you look at the manual approach of a refund. So if you look at your billing, the billing receives a request for refund, or the biller runs a credit balance report in NextGen. They review the encounter details, they view the transaction details, et cetera. You can kind of follow the flow chart. And then it has to go up to the accounting after they send the refund report to accountants. Enters payee system into the AP system, enters the check amount in the AP, prints the check, sends the check to report to data, and then data entry. Receives the check details, and then you go back and you enter the check information in NextGen, and you locate the patient chart in NextGen, and the refund process is complete. If you take a look at the process improvement by Refund Manager, you can see all of those grayed out areas that go away, because Refund Manager is taking care of all of that. So you receive the request, or you run the report, you post the refund batch, you batch processing of checks, the batch printing of checks, and then it updates the chart in NextGen with the information, and the refund process is complete. So you can see all those steps that have been taken out of this process and how easily that happened with this program. So how does it work? Well, it works by you selecting a credit balances to turn into refund transactions with just a click of the mouse. So this is just a sample screen of how you can highlight and click those. And you make your selections, and you can see that this is the Refund Manager screen. So that's just kind of the final steps of everything that we wanted to present to you today. We at Itentive have a lot of other things that we can do, and other ways that we can offer. So if you're uncertain where your practice stands, let us help by assessing your current readiness, providing recommendations, implementation of new processes and procedures, or, let's move forward with some of our products. You can visit us at itentive.com. You can sign up for the webinars. You can consider some of our 3-day fixed price on-site consultations, clinical workflow, revenue cycle and front office, technology performance, and test drive some of our products. So now we're going to turn it over to questions, and we'll be happy to take these and work through them as we get them, because I think we've had quite a few. So Chelsea, I'll hand it back to you.
Perfect. Thank you, Cindy. Okay, so first question, does the auto-enrollment require 5.9 version?
It does not. We have it. We have it. We have that in a number of different versions.
Great. Next question. Have you ever developed a way for a provider to look at their future schedule and schedule their existing patient for a future appointment at the end of their visit directly from the EHR?
No, I don't know. That's an interesting one, and I've had groups talk about that, but it always comes down. I've not had a lot of them who really wanted to let the providers actually schedule. It's an interesting concept, and I don't know of anything on the NextGen roadmap that's going to do that either. But no, we haven't looked at that.
Okay, next question. When using the Unapplied utility, how would it work for a back-end office when the charges are entered first, then the unapplied payment?
Okay, that's going to be a hard one for me to answer because I'm not quite sure. Most would have a conversation. I want to talk about it because typically when you've got the back-end office entering the charges, are you taking the payment at the front and it's sitting there to apply? Because technically, when you enter the charge, it should just automatically pop up to apply. So I'd be interested in your workflow. I would venture that it would find it because it's still the same concept, but I'm wondering why that's not happening automatically. So I'm maybe not understanding something about your workflow. Usually this particular tool is used when someone is, those things get missed or the patient may be left. There's lots of reasons why you have those unapplied. Just that, you got your charge pass-through coming from EHR, the provider documented it in the wrong encounter. I mean, I can come up with hundreds of reasons how this happens when the NextGen workflow doesn't work or doesn't actually catch that. And that may be what we're talking about. It may be your workflow. And if that's the case and it is some kind of variation in the standard workflow, I'm sure this would work for you then. I'm pretty confident about it, but I just want to understand.
Okay, next question. With your ChartGuard product, would it still work even if we lost connection to the internet?
Yes, that's actually the perfect solution for it because it's downloaded it the night before, and so it goes back 3 days, 4 days, etc. So if you didn't have connection to the internet, that's the perfect solution for it. If your network is out or your internet is down, the only time that it's really not useful, and even then it would have to be for a long time, is if your power was out for multiple days longer than your backup battery would hold, or if you had a generator that wouldn't hold. Otherwise, because it's stored on a PC in your office, so it actually keeps the data there. That's the entire purpose of it.
Can you use RefundManager in a hosted environment?
Yes.
Okay, perfect. Well, it looks like that's all the questions that we have for today. We'll hang on another minute here just in case anybody's in the middle of typing a question. And again, I'll be sending out an email follow-up within the next week with a link to the recording and the slides, as well as a list of our offerings. So if you were interested in some of those complimentary scripts that we talked about in the beginning, you can reply back to that email, and we'll get those to you.
Right. And while we're waiting online,
yeah,
complimentary scripts, just for those of you who are still here, we're happy to send those out for you. They will be as is. And then, most of them could be tweaked in your environment. If you have the technical expertise to do that yourself, they will, they're yours to do with. However, if you do need our help, probably wouldn't take more than a couple of hours of effort for us to, advise you, and we could certainly set something up for you. So either way, we're happy to help. We just want to make sure that we can get those to you if you want. And that's the first 3 that we talked about in the webinar.
Okay, perfect. Well, Lindsay, thank you, and Cindy, thank you, and thank you everybody for joining us today. Keep your eyes out for our next invite for those upcoming webinars that we talked about in the beginning, and I hope you have the great rest of the week.
All right, thank you, everybody.
Thank you.
Bye.